And if you have any hopes of playing at the next level, you know, obviously injuries happen, unfortunately, but if there's any way we could reduce that or suppress that, then that's what we're looking for. So basically with the Mark Pro, it's a recovery unit that provides some electric stimulation to some sore muscles. In this case, he threw a lot of pitches yesterday, has a little bit of elbow tenderness, so we're going to go with ice today. Sometimes we'll go with heat. But the Mark Pro itself, it's at a particular setting where it creates a contraction, an involuntary contraction. When we create an involuntary contraction, he doesn't get fatigued. If he was doing the contractions himself, like working out, he'd get fatigued. So at this point, what we're doing is we're creating blood flow to that area through the unit, the Mark Pro unit, creating that contraction, but without him getting fatigued. So within that blood flow, we bring, carries traumatic exudates, which are basically the healing properties that are built into our circulatory system. So with this rush of those healing properties, you'll start to see that it'll accelerate his healing properties and it'll get him recovered for that next outing. So with the shoulder, we're able to put it at a little bit more higher setting because it's a larger muscle, larger body part, and you'll actually see those contractions, those involuntary contractions with this. That involuntary contraction right there, that aids in getting more circulation to those muscles that are sore and tender from throwing. And we're going to throw some ice on there as well just to knock down some inflammation. Good, and we'll do that for about a 15-minute treatment with them. They're done throwing. Typically, when they extend their arms, you'll notice that their throwing arm doesn't extend as much as it normally does, so they'll lose range of motion pretty much after they throw. They'll start to regain that as the hours progress. But one of the things we like to do is a Graston or myofascial soft tissue work with them. 1 minute, 2 minutes of work. Basically, we do a little bit of a scraping technique here on that medial elbow. And we're, again, trying to create some blood flow. The more blood flow to that area, the more TLC that we give to that area, the more healing properties, and you'll start to see that'll open up. As a physical therapist, it also allows me to assess with older pitchers, older throwers. It tends to get a little bit gritty in there, and you can almost feel like gravel in there. If you did this with me, you'd feel like gravel in there. With our younger guys, they tend to be a little bit smoother, but we still try to assess as we go through this process. All right, basically what we're doing here is a little bit of a Graston technique or soft tissue mobilization work where we're doing what we call scraping, basically. And by using these tools, we're trying to create a little bit more blood flow in the medial elbow. In the elbow, after throwing, it tends to get a little bit of stiffness in there. And what we're looking to do is just create a little redness in there, not bruising, but a little redness. It doesn't take much, a minute or 2 minutes of a little attention to that medial elbow. And when we get extra blood flow in there, as we know with circulation, we get all of our healing properties or traumatic exudates. So if we get a nice flush or a rush of blood flow here, it'll accelerate their recovery process and start to loosen up that elbow a little bit before their next outing. Next thing we do is actually gained a lot of popularity over the last 2 years or so. It's called a voodoo wrap. Basically, it's a little bit of a blood flow restriction, but we're going to do about a 50% wrap here. Not too difficult. These guys are kind of used to this already, so we can probably go up to about a 75% pressure wrap. In this case, we're just going to wrap that elbow. Once it's all snugged up, I'm going to have him do a couple of exercises. Okay, going to give me 10 pumps, so curls. And his body's fighting or milking through that resistance. That wrap creates a nice tight resistance around the joint. Going to give me 10 curls, and then when you're done with 10, gentlemen, you're going to give me wrist flexion extension 10 times. Once we remove these wraps, you're going to see blood flow rush to that area. Again, same thing. When we get that natural blood flow to come in there, it's almost an exaggerated effect of recovery. And you can see even the skin turned color from white back to that redness in there. So there's a little bit of a rush of blood to that area. Again, just another way to just enhance that elbow recovery, keep these guys healthy pitching on the field. All right, so we're going to do a little rhythmic stabilization first, and I'm going to follow that with proprioceptive neuromuscular facilitation, PNF patterns. They're physical therapy techniques that we use to either strengthen the shoulder joint or also kind of help the recovery, just to stimulate that area. So you're going to go fist here, hold, don't let me move you. There you go, nice and tight. So I'm just applying varied resistance. I'm keeping it gentle. I'm not trying to overwork them. Just a little activation in that rotator cuff. Good, and relax. And now we're going to that PNF patterns. Fist in. Good, thumb down. There we go. I'm going to provide, again, gentle resistance. It's going to be smooth transitions here. He's done this before with me, so we have a nice little rhythm going. And he's going to keep and maintain his arm slot, the position that he normally throws from. One more time, and relax. Good, and now just completely relax that shoulder joint. I'll get a little distraction to feel what's going on in there, and then we'll just shake it out, just kind of reflush through.
What we're working on here is thoracic mobility. All right, after they throw, thoracic mobility has been shown to get a little stiff, and we want to make sure we preserve it and maintain it. So Ben's going through some thoracic extensions where he's using the pressure of his rib cage into the roller to help loosen up those thoracic vertebrae and all the muscle attachments in the area. All right, next one is going to be with the peanut.
Start at the lower one.
Yep. We'll start at 3 points in the thoracic spine. All right. And he's going to do overhead extension with his arm to restore the rotation ability of the thoracic vertebrae. Just make sure you keep the ribs compressed. Yep. Feel a little crack when you pull them down.
Yeah.
Feel that? Just come a little bit out to the side. A little bit out to this way, yeah. There you go. Yeah, now you can feel it. Good.
All right, so popular with the baseball guys, a lot of them they use the lacrosse ball, believe it or not, but not for purposes of playing lacrosse, but we use it for some myofascial release. It's a great thing to just kind of chuck in your baseball bag, and you'll always have it for you. So these guys are going to take a knee, and we're just going to work on your throwing arm. So left leg in front, both righties, correct? Right there's good. So we see a lot of guys just kind of rolling over the tissue, and they're not really doing an effective job of breaking up some of those fibers or adhesions in the shoulder. So came up with a little bit of different technique here. I'm going to have them place that ball right now. Sorry, right shoulder. There you go. I was showing lefties before. Good. So once you're there, lift that elbow up, take that right hand, and you're going to pull. The moment you start to pull back, that chest muscle relax, and you'll see that ball will sink into that tissue much deeper than if they did it rolling around on the wall or the floor. So once they're there, they're going to steer that lacrosse ball, and basically they're just going to dime-sized movements, guys. Just kind of dig in there. It's going to be a little painful at first. Kind of breathe it out. Find that spot. Spend about 20 seconds in one area. Once you feel good enough in there and that muscle is able to relax, then you're just going to drop it down lower, higher, just any tender spots at that attachment. So with pitchers, not only does the posterior shoulder get tight and that medial elbow, but you also see over time that pec minor, pec major attachment will start to get really tight and protective. And if that gets restrictive, it'll cause some more anterior instability in the shoulder. All right, so we always want to make sure all the surrounding tissue around the joint is adequate so that they can be ready for that next outing. All right, so basically we're going to do a little vibration massage on that posterior shoulder, posterior capsule, and all those deceleratory muscles. After throwing, those muscles tend to get really tight and lock up. So what we want to do is basically massage or vibration massage to break up some of that tissue, to create a little bit more blood flow through vibration stimulus, and it feels really good. Most pitchers, this is their favorite element.